Hello, and welcome to the Medicare Center agent demo for call recording. The Medicare Center team is so excited to tell you about the features and enhancements coming for AEP. So, let's dive in. If you're new to Medicare Center, the first thing you'll do is register for your account. You'll provide your NPN, first name, last name, email address, phone number, and you'll create a password. The phone number that you enter here at registration is important. So we'll come back to that, but just have a note in your mind that this is an important phone number. Once you have completed your registration, you'll receive an account registration confirmation email that will contain a link that you'll click to return to Medicare Center, and that will automatically complete your registration. And from that point, you will be able to log in using your NPN and the password that you just set at registration. If you forget your password, there is a forgot password process that will send you a link to reset your password as well. Once you log in, you will see this message. This is talking about call recording. And you'll notice if you've been here before that the homepage has changed. We'll talk about that and the reason for that in just a minute. But first, you will see this message letting you know that you have a Medicare Center agent phone number, that Medicare Center now provides free, compliant, and automatic call recording and storage per CMS requirements for all your sales calls using your unique Medicare Center agent phone number. Shows me that I have this phone number as an agent. My unique Medicare Center agent phone number is, and it lets me know that all calls made to and from my unique Medicare Center agent phone number are recorded, accessible only to me as the agent, attached to my contacts in Medicare Center Contact Management, stored by Medicare Center for 10 years per CMS regulation, and downloadable to my personal device. The Medicare Center agent phone number is generated automatically by our system. It's a one-time generation. So if you register for your account today, the first time you log in today, you're going to get this message with your phone number. If you have been to Medicare Center in the past and registered and logged in, and you haven't logged in since September 8th, the next time you log into Medicare Center, you're going to receive this message. September 8th is the day that we delivered the call recording functionality out to MedicareCenter.com. And so from that point, the first time everybody logs in is when they get their number. At that point, the number is set. We don't currently have a mechanism for changing it. We'll come back to that in just a moment. The Medicare Center agent phone number is generated based on the phone number in your account profile. During the registration process, I mentioned that this phone number is important. The reason that it's so important is that the Medicare Center agent phone number is generated based off the area code in your account profile phone number. So for instance, my number here is an 801 area code. That's a Utah-based area code. There wasn't a number available in the 801 area code when my number was generated. So the system looks at other area codes that are local to Utah. In Utah, we have 801, 385, and 435. So it generated a 385 phone number. So as an agent in Utah, that should not be a strange area code for my contacts to see. That should make sense to them. A couple of notes about that. So first off, the Medicare Center agent phone number, as I mentioned, is generated based off the area code here. If you had already registered for Medicare Center and you had a phone number in here that is no longer applicable, you've moved, for instance, and now you have, let's say, a 714 area code. If you need to change that so that you can generate a similar area code, you'll want to send an email to support@MedicareCenter.com. Let them know that you've changed your geo area where your contacts are, And they can, from there, provide you with the steps to get that number, to let go of this number and get a new one based on your new area code. There isn't a mechanism yet for agents to request a new Medicare Center agent phone number, which is why we're directing you to support for help right now. However, we are looking at adding that and some other features to the Medicare Center agent phone number. But be assured that if we do that, we will always have you opt in if we're going to change your number. We'll never just change your phone number out from under you unless it's something that you request or agree to. Because your number here is being generated based off the area code, when your number is generated, this phone number cannot be a toll-free number. The reason is that our system is not able to generate toll-free numbers on behalf of agents. So you'll need a regular US-based area code here. From that point, after this is generated, you can change what's in this value at any time. This is the device that actually rings that you're going to pick up when the incoming call comes in through this number. So I've got this set. Now let's say that this is my landline, I want to change it to my cell phone number, I can just change it here and save it, and it's not going to affect the number that's here. Once you have your number, you have your number unless you contact support. I've been asked, can I, for instance, take another number? Can I forward my 800 number to my Medicare Center agent number? You can do that. However, in the areas where Medicare Center provides the incoming call's phone number as the caller ID, you won't see that. You'll see whatever the toll-free number is, the 800 number is that's forwarding to your agent phone number. The number that your agent phone number is forwarding to, meaning the number for the device that's going to ring, can be a landline, it can be your mobile number, it can be a voice over IP solution, although there may be some nuances in that depending on your provider and your setup that may need to be worked through. One very important thing you'll need to do to make sure that your Medicare Center agent phone number always rings through to your cell phone in particular is add that number as a contact to your phone. That way it will always ring through, and you'll recognize it and understand the context so that you know how to answer it appropriately. The other number that you'll want to add to your Medicare Center agent phone number is the Medicare Center operator number. That number is 254-271-0085. You as the agent are the only one who's going to see this phone number. When your contact calls your Medicare Center agent phone number, so they dial this phone number, it's going to ring through to this phone number that you sent, and the caller ID on your agent phone is going to show this phone number. So when you add this phone number as a contact, you add it as Medicare Center operator or whatever is going to help you understand that this is an incoming call that's automatically being recorded. We'll talk about where you as the agent will see your Medicare Center agent phone number on the caller ID in just a minute. Now that we've talked about how the Medicare Center agent phone number is assigned, let's see it in action. I can be on any page in Medicare Center, it doesn't matter which page. I'll go here to my contacts and show you. I need to grab my phone number. One moment. Okay. This is what the contact will hear.
Thanks for calling. Please hold while we connect you to your licensed Medicare insurance agent. This call will be recorded for training and quality assurance.
Okay, now as you can see, that incoming call banner is right up here. So it shows me the incoming phone number. I can pop up the call script that I need to read. This you still have to read even though you heard it on the whisper, the IVR that you could hear when I had my phone on speaker. This is the TPMO required disclaimer, so that you would need to read both of those. While I'm here on the call, I can link it to a contact. I can create a new contact, or I can add it to an existing contact. So I am going to create a new contact. And let's see. Okay, right now we do have a little enhancement we need to add where this phone number is not populating down here into the contact's phone number. So as you can see, I copied it. I'm going to paste it in, but that's something that we'll have fixed shortly. Once the call gets disconnected, you'll see the incoming call banner closes. That took a little longer. Sometimes that happens in our testing and demo environment. So for Mary, all I need to save her contact record is her first name, her last name, and either her email address or her phone number, depending on which one you set as the primary communication method. I'm going to save her record now. Contact was added successfully. It's going to refresh, and now I am in her MedicareCENTER Contact Management contact record. So up here I can see all of the top level information about Mary. I can pull up the call script again if I need it. You'll see here that the incoming call that I got was recorded, and it's here in my activity stream on the overview page of my contact. From here, I can download the call if I need to. You can see that this is another system-generated activity. So there was one when I created the contact. There's another for the incoming call. I can add my own activities as well. And I can add my own reminders. So for instance, if I wanted to remind myself to call Mary back tomorrow, don't forget, call. Great. Now, when I have that call with Mary, I'm going to see this incoming call recorded. I would have another one if I did another call with her. And I can click on it, and again, I can download the recording, and I can add an activity note here, so I can add notes about how the call went. Now, for the most part, this is as far as you need to go on an incoming call record. The only time that you will be required to download is if CMS or the carrier comes back to you and says, hey, Deja, there was a complaint from Mary, and we're going to need the call recording from September 12th. I would download it, and then I would submit it. No one but you is able to download these calls other than our back-end engineering team, who is responsible for the storage of those calls. So nobody's going to download that. If you want to listen to your calls, if you want to try to improve your own sales process, you definitely can download them. And you can download them to any device on which you're logged into Medicare Center. Please be aware that once you download the file, as soon as it's downloaded, it becomes your responsibility to store securely. It's likely that your beneficiary's personal health information is in that call recording. So be very careful. If you don't need to download them, probably better not to. If you do need to, it's probably best to delete them when you're done. From the dashboard, I can also see all of my activities across all of my clients. And as you can see, I missed a number of calls from this phone number. These are going to stay up here at the top in blue so that they grab your attention. Once you connect them to a contact, then they drop here into the recent activity across your contacts. You can download them from here. You can also link to a contact. So if I need to download this call so that I can remember who this was from, I can download it. And then once I remember who it's from, I can link it to a contact. Again, just like I did from the incoming call banner that was up. Here's another button for the call script if I need it again. For existing contact, I can do a search and select a contact. And then I'm automatically back in her contact details. And now I have another incoming call recorded from her. And now you can see that I have one fewer number here, and I have an activity here for Mary. From Mary's contact record, if I need to update any of her personal information, I can do that here. And I'm going to put a zip code on this record so that you can see how to view available plans. So once I have saved Mary's information, you'll notice that the View Available Plans button becomes available. Right here is where I would send a scope of appointment. In Details is where I would add provider, prescription, and pharmacy data. And that is a search based on the zip code. And I can start typing here. It's the same for prescription and pharmacy. For providers, you can add as many providers as you need to for this contact. Same with prescriptions. For pharmacy, we do have a restriction right now to just one pharmacy. If you don't enter a pharmacy, it will estimate the cost in the plans based on mail order pharmacy costs. Once I've sent the scope and I have at least her zip code, state and county information, I can view available plans. From here, it's easy to get back to Mary's contact record or edit her contact information. You can sort by plan type, effective date. Again, because I didn't enter a pharmacy, it's showing me that it's based on mail order. I can filter by carriers. By default, I'm only able to see my appointed plans. I can remove that filter to see all plans. I can, as the agent, compare up to 3 plans. This is my agent view, so I'm just looking at it here. Shortly, we will have a share button here where you'll be able to send this quote, this plan comparison, out to your contact. So that is coming very shortly. Back to the dashboard for just a moment. The dashboard, while we're here, gives you, as we mentioned, your recent activity across all of your contacts in contact management, and it's going to give you the inbound call log for any missed calls. It's possible that you didn't actually miss the call, that you just were not at a place where you could enter the contact details yet. So from here, you can do the same thing. That is the functionality for incoming calls. So now let's take a look at outbound calls. With outbound calls, this is where you'll want to remember that MedicareCENTER virtual operator concept. Because when you want to call your contact, you're going to click the phone number, and that is going to initiate the Medicare Center virtual operator. The way that outbound call works is that operator will call your number first. When you answer, it will then call the contact number. And then when the contact answers, it will merge those two calls together so that the two of you are on the call together. When I talk about the operator, especially if I ever refer to it as a three-way call, which it's honestly not, people want to know if they can conference another person in. And unfortunately, you cannot. It's just the two numbers together that will be recorded. So I am going to click on her number. It's letting me know it's initiating the call. It's got the call script pops up automatically. And what's going to happen is my phone is going to ring. So the number in my account profile is the number that's going to ring. You'll pick it up. It's going to ring from your Medicare Center agent phone number. That's the phone number you'll see on your caller ID. You'll answer. Once you answer, it will call your contact. While you're waiting for your contact to answer, you're going to hear their line ringing. That's when the call recording begins. So if I am on the phone and it's ringing, and I call to my dog to come in out of the backyard, or tell my kid to pick up her socks, or whatever it may be, that is going to be recorded. That's part of your recording. Your contact is not going to hear it, but it will be part of the recording at the beginning. For both inbound and outbound calls, Medicare Center does store your recordings for 10 years as required by CMS. That is the case even if you terminate all your contracts with Medicare Center partners. So if you simply stop being appointed to sell, your contracts expire, or you will not be removed from Medicare Center. You'll be able to still access it. You can still go in and get into your contact management, access your call recordings. You just won't be able to quote and enroll. In some cases, we may terminate your access to Medicare Center. If that happens and you receive a complaint further down the road, and you're being asked to provide the call recording for Mary Lamb on September 12th, you can request that from support@medicarecenter.com. Let them know your NPN, the name of your contact, and the date of the call, and Medicare Center support will provide that to you. So to recap on an outbound call, you initiate an outbound call to a contact from their contact record in Medicare Center Contact Management. You click on their phone number. You'll receive a call from your Medicare Center agent phone number. You'll answer it. It will ring to your consumer and they'll answer it, or their voicemail will pick up. If their voicemail picks up, you'll be able to leave a voicemail for them. And then if they call you back from their call log, that will be on your Medicare Center agent phone number, and that will automatically record the call when it comes in. For an outbound call, the number your contact is going to see on their caller ID is your Medicare Center agent phone number. When a contact calls you, the number that will call you is the Medicare Center operator number. The Medicare Center operator number is 254-271-0085. That's the number that will ring your phone when you have an inbound call. The consumer is still just going to see they're dialing your Medicare Center agent phone number. If you call them back, that will be the number on their caller ID, as I mentioned, and then they can call you back. And it's really important that you add that Medicare Center operator number and your Medicare Center agent phone number to your phone contact list, especially on a mobile phone. The reason why is that some phone settings, some cell provider settings can cause your phone not to ring from an incoming call. In that case, what happens is the operator, the virtual operator, doesn't know that you're not hearing the ring. It's hearing the ring. So when it hits your voicemail, it thinks, okay, the agent is connected, and then it's going to dial out and contact the consumer. If the consumer answers at that point, the agent's not going to be on the line with them. They're going to end up leaving the agent a voicemail. So obviously that's not an experience that we want to have happen, and that's why it's so important to add both of those numbers in your phone. As I also mentioned, and we've seen several times throughout this demo, this has replaced the previous homepage in MedicareCENTER. The reason we did that is because the call recordings are connected to the recent activity here in the dashboard, as well as the activity stream in your contacts record. Make sure that you have easy access to all your call recordings, that those are front and center. The dashboard has your recent activity across all your clients. It also will tell you the number of confirmed applications you have, and that's across all 3 of our MAPD enrollment options. And then in MedicareCENTER Contact Management, you have these snapshots where you can click to filter down to all of the contacts who are in that new status, which all of mine are. We hope that you love quote an e-app in MedicareCENTER Contact Management, and we hope that it will serve all of your quote and enrollment needs. If for some reason it's not working for you and you need to launch one of the other platforms, we've just moved it up here under your name in the navigation. So here I can launch Medicare app, Medicare Link, CSG. We've moved the Need Help button over here to this menu as well. It doesn't matter where the call recording lives. So you can take an inbound call from MedicareCENTER and end up quoting and enrolling through Medicare app, and that's completely fine. If you have to provide that recording to CMS or the carrier, it doesn't matter which tool you used. How to add a contact from an incoming call. So let's look at a couple other ways you can do that. You can click Add New. As I mentioned, all you need to save the contact is their first name, their last name, and either their email address or their phone number, depending on which you set as the primary communication method. Click Create Contact, and it will take you into their contact details, where you can add providers, prescriptions, pharmacy, send the SOA, all of the things that we have seen in quote an e-app inside of contact management. You can also import contacts. If you save them as a CSV, this is the list of fields that you can import. The column names in your CSV need to match this. There's a template you can download as well if you have questions about how that should look, and then you can fill that in with all of your information. You can sort and filter. There is also a card view. You can toggle back and forth between list and card view. By selecting one or more records, you can also delete and export. To update one of my records, so I'm just trying to copy this so that I can show you how to handle household links. So right now, Jane Doe and John Doe each have two separate phone numbers. If I update John's phone number so that it is the same as Jane's, when I save that, it's going to let me know that I can create this contact, but the entry is a potential duplicate. It will give you the link, and then I'll see Jane here. That's okay. I know they're married, so I'm going to close out of that. Save changes here. To be a unique record, you need a unique first name, last name, and either phone number or email address. So John and Jane can share a phone number. And can have Jane Doe and John Doe with the same phone number because their first names are different. I could have Jane Doe and Jane Smith because their last names would be different. I just can't have two Jane Does with the same primary contact information. Own advice here, and I'm going to delete that in just a moment. I probably won't show you that, but I am going to delete that file as a best practice. We also have a learning center. This video training hub is the best place to go for our training videos. We make videos about all of our features, so that's the best place to go. We also have user guides, frequently asked questions, etc. That is Medicare Center with contact management and quote and e-app. Speaking of our features, we do have some exciting things coming over the next couple of weeks as well. We have Pearl's personalized agent websites. We have share quote with contact. We have contact management tags, real-time leads availability, switchers and cross-sells, and the Medicare Center mobile application. The mobile application has the same features as the web app that we've been going through here. The main difference between the Medicare Center mobile app and this web application is that when a call comes in, instead of seeing the incoming call banner at the top that we saw on the mobile app, you'll actually receive a push notification. You do not have to have the mobile app to take advantage of call recording, inbound and outbound, or quote and e-app. Concludes today's demo. Thank you so much for taking the time to watch this. If you have any questions, please check our Learning Center or feel free to reach out to support@medicarecenter.com. Thank you.